Many have dreams to be a medical professional. When choosing an institution for medical school, a lot of things matter. The quality of the academic and clinical programs, as well as the clinical experience. At UNIMAS, we offer that and more. A supportive culture, a vibrant community, diverse student and patient population, all set against the backdrop of Kuching and Kota Samarahan.
The culture here is welcoming. It is a big family. Everyone wants the next person to succeed together. We want our students to reflect back to the society and the community today. As a community-driven university, we believe that immersing themselves and ourselves in the diversity, it creates better innovation and greater creative achievement.
In UNIMAS, there's not a culture of a competition here, but a great environment is what we all strive for.
Everyone is committed to create a great environment to become a great doctor in the future.
Our patient population in Malaysia is remarkably diverse. Different languages and dialects will be something that we face every day once we become a doctor. So, getting to know this and learn it now make us to be more appreciate and respect. It just set us up to become a better doctor for the future.
From the beginning of the program, 25 years ago, we have adopted a spiral curriculum. As the students advance forward into their years of clinical study, we connect everything back to underlying basic biological sciences. We connect and revisit every aspect of human health, from emotions to diseases, back to its basic biological sciences.
We are introduced to clinical setting early in our curriculum. The exposure gets more as we advance through the year. It was very daunting at first, as a first-year student, to step into hospital and seeing patients. But at the same time, it's really an exciting experience.
We are committed to excel in nursing education, research, and practice. It views health as a complex and dynamic, and the client as a holistic individual. Students in this program learn in an environment that stimulates intellectual inquiry and creativity, which encourages them to be problem solvers and lifelong learners.
Here, we learn how to care, to serve, and to help. We went from zero to hero.
I really cannot pick a better place to learn and become a greatness. This is a place that belongs to my heart throughout my journey.
Come do research with us.
Come and join us at UNIMAS and realize your dreams.
Assalamualaikum and good morning, everyone. I will reshare the. Can everyone hear me? Yes,
Can.
So I will reshare the QR code after this. So it's already 10 o'clock. So we'll begin our session today. Assalamualaikum and good morning to everyone. Welcome to our health talk by Department of Basic Medical Sciences. So first of all, I apologize for the problem with the QR code, but I will reshare that again later. So today we will be untangling the mystery behind the human memory and emotions from the scientific lens or scientific point of view. So these two components are super important for us human beings, which makes us human and highly functioning in a highly sociable ecosystem. So without further ado, I will introduce our first speaker for today, and the second and the third one. So I'll introduce the speakers. All of the speakers comes from Department of Basic Medical Sciences in Faculty of Health Medicine and Health Sciences. So let me introduce our first speaker, that will be Dr. Nohida Ramli. So Dr. Nohida Ramli is a medical lecturer who specializes in clinical anatomy. So she is currently teaching both medical and nursing students of our faculty in UNIMAS, with a special interest in research of anatomy education and neurosciences. So she's a dedicated member of the Committee for Malaysian Anatomical Association from the year 2023 until the year 2025. So we'll be expecting some massive contributions in terms of conferences and everything from Dr. Nohida for the next few years. So secondly, our second speaker will be Dr. Saiful Bahri bin Talib. So who is our senior lecturer in the anatomy discipline. So he has a massive or decades of experiences in teaching medical and nursing students, with a major research interest in neuroanatomy and anatomy education. So he is currently working on a project for medical education in the point of view of anatomy. So he will be sharing those information and all domestic data later on with us. So the third speaker for today is Dr. Miat Subo, who comes all the way from Myanmar. So she's one of our medical lecturer, majorly teaching nursing, medical and nursing student as well. So she's an experienced educator way back in Myanmar. So she began her teaching experience in Myanmar. Now she's teaching in UNIMAS for both of our medical and nursing students. So she is part of the research fellow for Borneo Institute of Studies in UNIMAS. So without further ado, let us explore this topic of memory and emotion. Let's begin with our first speaker, which is Dr. Nohida Ramli. So I hand over the floor to you.
All right. Assalamualaikum. Can you hear me? Yes?
Okay.
All right. Okay, good. Okay, Assalamualaikum and very good morning, everyone. Thank you for joining us in this talk about the memory and emotion. So I'm Nohida. I'll be presenting about the hippocampus and memory. Okay. So have you ever wondered where is the memory stored in brain? Okay, like in the computer, you must have the external hard disk, or you have your USB or SSD for the memory storage. So that like the computer, our brain have that fantastic area called the hippocampus. Okay, before we go into detail about the hippocampus, let's look at this picture. Okay, this is the area, the central part of the brain. Okay, this area is called the limbic system. Okay, the limbic system is the center, located at the center of the brain, is where the emotion, the memory, and all the integrated information in the center of the brain. And the structure about the limbic system will be explained further later by Dr. Saiful. And there is the hippocampus. Okay, as part of the limbic system, hippocampus is located at the temporal lobe, medial temporal lobe specifically. Okay. Okay, what is limbic system function? So limbic system of overall function is important as the brain emotional hub. It helps us feel emotions, remember important experiences, and respond to things that are rewarding or threatening. So for this particular function, remember important experiences, this is done by the hippocampus. Okay, how is actually data from external stored into the hippocampus? Okay, it's begin with the sensory information signaling from the external, like smelling, hearing, and looking or visualizing or touching. All this sensory information receive at the different part of the cerebral cortex, particularly for the smelling is the information is received encoded in the area called the olfactory cortex, and for touching is encoded in the primary sensory cortex, which is at the parietal cortex, and for the hearing auditory is by the temporal cortex, and visualizing is by occipital cortex back here. So this is anterior and this is posterior, and this is the cerebellum. So different part of the sensory information is then encoded, and the data from all this region transferred to the center part of the brain called the hippocampus for the memory processing. So we process the data so that we can remember the thing that we smell, we touch, we hear, and also we look. So this is really important in learning. Okay. So what is hippocampus? Okay, this is how it looks. This is the illustration image of the hippocampus. Hippocampus is as part of the limbic system, as I explained before. Hippocampus is come from the word Greek. Okay, it's basically simply means seahorse. Okay, you can see this is seahorse, and this is the real hippocampus dissected from human brain. So they look like each other. So this is the hippocampus and this is the seahorse. So they look like each other. So this both thing is the hippocampus. One is the seahorse and one is the human brain. Okay. All right. Hippocampus act as a center for memory consolidation. So what is memory consolidation? Okay. Memory consolidation is the process where when we receive data from external, we want the memory to stay longer in our brain, so we can remember that data longer, so retain the memory. So hippocampus is important for new memory consolidation. So my friend Dr. Miak will talk about memory further on later. Okay, so diving further into the structure of the hippocampus, we call this cytoarchitecture, which simply means the cells organization of the hippocampus. You can see this hippocampus. This is hippocampus. Okay, this whole thing is called hippocampus. It looks like a Swiss roll cake. Okay, so it can be further divided into this region called the dentate gyrus, and this is called the conoaminas or CA. It has further divided into CA3, CA2, and CA1. And here is the subiculum and the entorhinal cortex. Okay, how is the information from the cortex of the brain enter the hippocampus? Okay, from the external, remember the data from different part of the brain that I mentioned earlier on, transferred towards the inner part of the brain via the entorhinal cortex, and it makes synapse with the first loop here, or first synapse with the dentate gyrus. Okay, second synapse is between the dentate gyrus and the CA3, and the third one is from the CA3 to CA1. It can come out with the output if it's required output, but it can be further looping in again, yeah, and this cycle. So this is called the trisynaptic loops. So the more the synaptic loop occur, the more the earlier the memory consolidation occur. Okay, this is happen in normal loop, a normal hippocampus, but in damaged situation, when the trisynaptic loops is problem, and when the hippocampus is damaged, the memory consolidation will be impaired. So this can be seen in the hippocampal damage caused in Alzheimer's disease. If you ever heard of Alzheimer's disease, we call it Nyanyo in Malay, and it causes memory loss. In Alzheimer's disease, eventually, initial part of the Alzheimer's disease, that the patient will have the damage or neurodegenerative in the hippocampal region. We call it damage of the hippocampal region first, then later it affects different part of the brain. So that's why the initial presentation of Alzheimer's disease can be anterograde amnesia, so fail to memorize new things, but still can remember the all memory. So this is the initial stage of Alzheimer's disease. But as disease progresses, it can affect different part of the brain. Okay, this is the brain. This is a human brain. The name area in this picture is important for brain memory system. Integration of and connection of all these regions is important for overall brain memory system. So, but I'm going to talk about the hippocampus. Hippocampus here, this region important in episodic memory storage. Like you remember the first time you learn cycling. So the episode of cycling, the first experience of cycling is called episodic memory of hippocampus. As you train and train again, so this is happening. A series of memory consolidation processes transfer this memory to neocortex. As time goes by, you now become expert in cycling, or even cooking, or even driving, and etc. Okay. So this, let's go to previous years, or in 1953, but before that, this is Henry Molaison. Okay, Henry Molaison is the history of Henry Molaison. When he was 7 years old, he was involved in bicycle accidents. So because of that accident, he frequently attacked by epilepsy. So a series of severe epilepsy, making the surgeon that treating her decided that he want to remove the medial temporal lobe of the HM brain. So hippocampus is part of that medial temporal lobe. So alhamdulillah, after the surgery, the epilepsy gone, and no more epilepsy episode occur. But after the surgery, he had difficulty retaining new episodic memories. He completely unable to permanently store new information. So this is called anterograde amnesia, where we cannot integrate new memory and consolidate it. But despite having no memory of practicing certain skill after the surgery, but he could still improve on motor task, likely relying on all memory stored in the neocortex. So because of HM case, this big impact in the neuroscience community, where they discover the different area of the motor storage in the brain, not just on the hippocampus, not just the neocortex. So it's involved different area of the brain. Okay, from this story, information from certain memories that are temporarily stored in the hippocampus are transferred to the neocortex as general knowledge. Okay, and after consolidation and this memory transferred from the hippocampus to the neocortex as we sleep. And this happens as we sleep. So this is why sleep is really, really important for the one who is learning, including students and all of us. Okay, I think that's it for this initial part. I give back this mic to Dr. Marlina. Thank you.
Okay, thank you, Dr. Nohida, for sharing us on the complexity or complex structure of the hippocampus. So, which implies to us that the brain is able to manipulate all these external environments surrounding us, including all the senses that you feel on your skin, in your ear, from your eyes. So, it has this ability to decode this weird information or weird senses from external to come to be into something that it is interpretable or being able to be understandable by us. So let's another interesting point that Dr. Nohida pointed out was the trisynaptic loop. It reminds me of the complex structure. That complex structure reminds me of this roda kehidupan lah. So in Malay we call this roda kehidupan. In English we call it the cycle of life. So how complex our life is, that is more complex our brain is. So next we move to Dr. Saiful, who will be presenting another structure from his point of view related to memory and emotion. So I give the mic to you.
Okay, thank you, Dr. Mariana. Okay, can you see my slide?
Yes, can you see Dr. Saiful?
Yes,
okay.
can.
Okay, right now it's my turn to explain to all participants regarding the most important structure of human brain, which is the limbic system. So for your information, the brain itself actually is a big structure that located inside the skull bone, but somehow there are small structure that also important. One of the component here, which is very important, is the limbic system. So now we're going to explore the important part of the limbic system. Okay, so for the introduction parts, we need to know what is the limbic system is all about. Okay, in general, the brain actually is a network of the interconnected structure. So try to imagine like our computer system, the CPU or central processing unit. The brain is like the CPU in our body. So mean that if there is a problem that happen in this CPU, the body cannot control the brain cannot control our body functions. That's why we have to maintain the goodness of this structure, which is the brain and also the limbic system. So we need to know where is the exact location of the limbic system. Okay, from the images that you can see from this picture, okay, it is located on the side of the thalamus. Try to imagine that the limbic system is located on the lateral side, meaning on the side of the thalamus. The inner part is the thalamus itself. So that is the location that you can find the limbic system. So this limbic system actually basically is located in the center of the brain. Try to imagine like a coconut, okay, fruit. We have a very thick fibrous tissue on the outer sides, and then we have the central core, which is very hard the very hard portion. So the part that very hard portion is actually is the limbic system. Okay, that is the way we imagine the limbic systems that we have in our brain structure. Okay. So in this structure, actually, the limbic system is located beneath or under the cerebral cortex. The huge structure here is actually belong to the cerebral cortex, which I already explained to my colleagues just now. So this cerebral cortex, it embrace okay, all of this structure, the limbic system. Okay, it also sits above the brainstem. As you can see here, this is the brainstem. So the brainstem itself is divided into three structures, which is the midbrain, pons, and also the medulla oblongata. So this is actually just the introduction part of the limbic system. Okay. Now we need to know the function of the limbic system. What is the importance of it's all about the limbic system? We're going to explore our journey. Okay, so the limbic system actually it helps to regulate the emotional processing. So you try to imagine if someone has problem with the limbic system, what happened to their emotions, and also important for social processing, learning process, motivation, and special memory. So this is the important function of the limbic system. So that's why we need to take care of this limbic system. Otherwise, the person who having a damage of the limbic system, she or he will be having a big problem. Okay. So we need to know how many parts of the limbic system that we have. It's not just a big structure like that, but somehow it consists of several components. There are 5 components of the limbic system that you all need to know. The first one is the hippocampus. As you can see here, the green structure here is actually belong to the hippocampus. This hippocampus has been explained by my friend just now, Dr. Nohendia, and then followed by the cingulate gyrus. Okay, the lighter color blue structure here, it's belong to the cingulate gyrus. And the third one is amygdala. It's a very small portion, red color portion here, the pea-sized structure. That one is belong to the amygdala. The dark color portion here is belong to the hypothalamus, and the last final portion of the limbic system, the basal ganglia. Now we're going to explore each part of the limbic system that we have in our body, in our brain. Okay, we start to discuss on the cingulate gyrus. Okay, so in order to discuss on the cingulate gyrus, we're going to use this, what you call that, corpus callosum. The corpus, okay, before we proceed further, we need to know what is the corpus callosum. Try to imagine, okay, actually the brain itself, it has 2 parts, which is the right half and also the left half. So we try to divide it in the middle, in the sagittal position, so we can have this kind of view. This is the medial view, actually. Okay, so in order to talk about this cingulate gyrus, we have to use a reference point, the corpus callosum. The corpus callosum is actually a big fiber. It's like the collection of the wiring system in our body that connect between the right and left part of the brain. So this is the corpus callosum. So this green color structure is belong to the cingulate gyrus. So we need to know how the cingulate gyrus is extend from the initial part of the brain to the final part of the brain. Okay. So you can see here, the cingulate gyrus, it commences below the rostrum of the corpus callosum. This is the rostrum of the corpus callosum, the thin part of the, here that you can see on the image here. And the second part, it curves, okay, it curves around in front of the guino. This is the guino of the corpus callosum. And then followed by the travel along the superior surface of the body. This is the body of the corpus callosum, and the final part of the cingulate gyrus is terminated at the narrow isthmus behind the splenium. This is the splenium of the corpus callosum. This is the extension of the cingulate gyrus. Okay, move to the next part of my presentation right now is regarding the amygdala. So amygdala is small compared to the rest of part of the limbic system. Okay, it is a 2-element shaped group of nuclei. Nuclei here means there are a lot of nucleus that present inside this structure. It is located deep within the temporal lobes. So my friend already mentioned about the temporal lobe just now. And it is located medial to the hypothalamus. As you can see here, this dark blue color structure is the hypothalamus. And at the same time, this amygdala also lie close to the hippocampus and also the inferior horn of the lateral ventricle. Unfortunately, it's not shown in this picture, the lateral horn of the inferior horn of the lateral ventricle. But the most important thing that you need to know, the exact location of this important structure, the amygdala. Okay, let's move to the next one regarding the basal ganglia. Okay, as you can see from the whole part of this structure, is actually belong to the basal ganglia. It is a group of gray matter mass. So try to imagine that on the superficial surface area here, on the cerebral cortex, we have the gray matter. And then beneath the gray matter, we have the white matter. And deep inside this white matter, there is this group of gray matter mass. So it is actually the basal ganglia is a mass of gray matter that embedded inside the white matter. Okay, so this basal ganglia is found deep within the white matter of each cerebral hemisphere. Okay, what is the component that actually belong to this basal ganglia? We have the caudate nucleus. For the caudate nucleus itself, it is divided into 3 portions. Okay, we have the tail portion here, it's like a tail, and then we have the body portion and also the head. So that we have 3 portions that belong to the caudate nucleus. And the second part of the basal ganglia is putamen. Okay, putamen, if you see here, this is the putamen. Putamen actually is a circular shaped structure. Okay, and then the final portion is the globus pallidus. Okay, for the globus pallidus, it is divided into two parts, which is the lateral segment. Can you see, if you see from this image, we have darker and also lighter color. Okay, so the lighter color is belong to the lateral segment, and the smaller portion in the middle here is belong to the medial segment. That is regarding the globus pallidus. So you can see the limbic system is very unique structure. It is very important part of the human brain. Okay, now we move to the next one regarding the hypothalamus. So the hypothalamus is actually represented by the green color structure area here. It's a small area of the brain, and it forms the inferior part of the diencephalon. Okay. Okay, sorry. Okay, so it is located anterior and inferior to the thalamus. Sorry, because there is some problem just now. Okay, this hypothalamus is located anterior and inferior to the thalamus. So this is the thalamus, and the hypothalamus is the weight is only about 4 grams. So you can imagine it's a very small portion part of the brain. Okay, now we go to the next part of our presentation today regarding the limbic system damage. So, in case if there is damage to the respective area of the limbic system, it can produce a certain conditions. So, if there is a damage to the cingulate gyrus, what happened? The patient may be presented with a lack of fear. And what happened if there is a damage to the amygdala? So, if the patient also having a fearless conditions. Okay. And the last portion, if there is a damage to the hypothalamus, what happened? If this hypothalamus is under activity, it may worse to depression. And then if there is hyperactivity of hypothalamus, it can cause anxiety. Okay, so this is the final part of this presentation regarding the quiz. So I'd like to ask anyone who are interested to answer this question. Okay, please identify the structural label A and B. Maybe if any one of you can type in the chat box in case if you want to answer these questions. Okay. Maybe we try to give around 3 minutes to answer this question. It's very simple questions. Okay, what is A and what is B? Okay, maybe the moderator will have to type in the chat box. Okay, so we have another 1.5 minutes. Can you give your answer? What is A and B? It's a very simple question. Okay. Okay, so now we're going to see what is the answer for this question. Okay, so the answer for A is cingulate gyrus. Okay, so okay, thank you to Nurul Hanif who gave a correct answer for A. And then the third one, the B is what? So it's amygdala. Thank you to Daniel Tay. Okay, that's all from me. Thank you. I return back to the moderator.
Okay, thank you, Dr. Saiful, for the interesting talk on the structure of the limbic system. So the coconut analogy was quite great. So it just reminds you of your brain every time you eat any types of foods. So just remember that inside your coconut got the limbic system that helps you to regulate your emotions. So without that center of the coconut, then there will be some dysregulation of your emotions. So which means nanti orang marah sikit, mungkin kita tantrum kan. So if it's children, then logic lah. But if it's an adult, so problem with the center core of the coconut, so it can make you a traumatic adult. So now that we've known the structure of both hippocampus and limbic system, which now we know already that these two functions in memory and emotions. So now we will go to Dr. Miat for Dr. Miat to share to us how do these two structures function and do they play a role in regulating our memory and our emotions. So I'll give the floor to Dr. Miat.
Thank you, Dr. Malina. Can you hear me?
Can.
Okay, can you see the screen?
Yes, can see.
Okay. Okay, good morning, everyone. Today, I'd like to talk about our Unlocking the Brain series for memories and emotion from our physiology points of view. Regarding for the anatomy, our two colleagues, Dr. Saifu and Dr. Nohida already mentioned. So you have idea of the structure regarding our memories and emotion. Okay, so what is memory? It is the brain's ability to store and access the information. Actually, it is a vital function since learning, thought, and reasoning could not occur without it. Because it makes our personality development. For example, if we learn not to touch hot object, for example, from a very early age, as we remember that they burn us and it caused pain. Moreover, our memory, the sum of our experiences, plays a huge part in the development of our personalities. Memory is a brain function. It is like a computer. It can store and process the information. You know, the information is never presented in one simple form, but tend to be embedded in a complex context. We have a two form of memory. The first is called explicit memory, and the second is called the implicit memory. Actually, the explicit, Dr. Nohida already mentioned, it is like an episodic memory. The other term, it is also called the declarative memory because they can declare, because they have the very clear events of this kind of memory. So its formation is associated with our consciousness, or we have some levels of awareness. So most of these processes occur at the hippocampus. You have known all that, the anatomy of the hippocampus already mentioned by the Dr. Saifu. And other parts of the medial temporal lobe, it's retention. So it is actually concerning with the factual knowledge about people, places, things, and events. So it is a very sharp memory. And then next is the implicit memory. Implicit memory is actually, it is like not like a conscious, it is an automatic event. So it is also called a non-declarative memory. So it no need awareness and no need at the hippocampus processing. Instead, we require integrity at the amygdala, cerebellum, striatum, neocortex, and other reflex pathway. Actually, it is very important for the training, reflexes, or perceptual skills. Dr. Nohida already mentioned how we train, because we can transfer this explicit memory into implicit memory after it is thoroughly learned. For example, we start with the bicycle, how to ride. So it starts as an explicit memory. When it began automatic, we no need to awareness of this feeling of the riding a bicycle. So we have automatic behavior. So it becomes an implicit memory. Okay, in the terms of the involvement, we can divide it into two parts. The first is called the short-term memory, and the second is called the long-term memory. So short-term memories mean very short. It lasts for the few seconds to hours, during which processing in the hippocampus and elsewhere later on into long-term changes by means of the synaptic strength. The inability to remember for short-term is the complex data cannot be stored in the moment that is perceived. So we require analysis and selection process that is necessary for the brain to determine which information is assimilated or discarded. Next is a working memory. It is a form of the short-term memory that keeps information available, usually for a very short period, while the individual plans action on it. So how we transfer short-term memory to long-term memory by means of consolidation. So we require the repeated behavior like the repetition, and usually we need to classify when we categorize into the same item to become a long-term memory. So consolidation move from the short-term memory to the long-term storage. So consolidation result in an alteration in structures of our brain as the memory traces form. So regarding for the long-term memory, it means they can last for a very long period in our brain, maybe many years or sometimes lifelong. During the short-term memory, memory traces are subject to disruption by traumas or various drugs. But for the long-term memory, they are remarkably resistant to the disruption. Here is a neural basic for how the short-term memories and long-term memories are incorporated within our brain. We started to receive the information as a short-term memory, and some are as a working memory. And some forms of memories are transformed directly into the long-term. At the same time, some we are used as the output from the short-term. But sometimes from these output results, we can retrace back again and store in our brain as a long-term memory storage. So how we make the storage of long-term memory? This requires we need a lot of process. These memories are stored in various parts of the neocortex, perhaps in the various cortical sensory area. For example, visual memories in the visual cortex. So the key to memory is the alteration in the strength of the selective synaptic connection, and this involves activations of genes and protein synthesis for our coding of the memory for the long-term storage. Next is the memory loss. There are so many causes for the memory losses, maybe the normal physiology, elderly, or maybe the disease process. For example, the bilateral destructions of the ventral hippocampus, maybe during the elderly person, they cause the degeneration of the neuron. So mostly affecting is the recent memory. So human with such lesion they have the remain remote memory as well as the implicit memory. So it means that they can make automatically what they learn in their early parts of the life, but they lost their recent memory. Especially we can find in the Alzheimer's disease. So it means that the person can know very well before their age of the 50. After that, they cannot know, especially what they did yesterday. So what is behind our emotion? So emotion is a complex feeling state with psychic, somatic, automatic, and behavior components. Emotion is mainly controlled by the emotional hub, the limbic system, already mentioned by Dr. Saifu. Okay, so the major part is the hippocampus. It is important role in the emotional experiences. Also for the amygdala, it is very important in the detections and response of the feeling, for example, fear. And the hypothalamus is important for the physiological reactions of our body, such as heart rate control, sweating, blood pressure, and so on. So how the emotions are triggered. Okay. So we sense all the feeling from our brain, especially at the thalamus. And after thalamus, there are many processes occur, and mostly they sent to the amygdala. At the amygdala, they cause the determination of emotional significance, and they have to assign emotional context and value. And after that, they provide a rapid initial assessment of its consequences. Okay, next is the role of reticular activating system, RAS, and emotion. By activating this RAS system, it produces a state of alertness. At the same time, they increase the pain threshold of our body. And also, they have the many visceral sensation as well as a spatial sense of our body. For example, at this time of our body preparation for these emotion, the person respond with the pupil dilatation. It is for the more light entries and increased visual acuity. At the same time, increased pain threshold. That is why, you know, some soldiers, they got injury in the heat of the top of the battle, but they didn't realize it. But after the finish of the battle, at the time, they really notice what is happening in their body. This is our body emotional influences. Okay, next, how emotional is influenced by our body structure. It is mainly by the hormone. So hormones are by means of control by our body nervous system. It is called the autonomic nervous system. Okay, so by means of these endocrine system, they produce a hormone. So they cause many visceral changes within our body. Okay, so we are prepared for the body for the emergency situation like the fight or flight condition. See, you have to face with the condition with fight, or you have to face with the condition with the flight responses. Here are some of the stress responses that will happen during our emotional stress by means of the hormone cortisol. It is very important stress hormone for our energy supply because they cause the breakdown of our energy storage, like the breakdowns of the glucose for our energy, and also for the adrenaline. They increase our body, increase the heart rate, increase the blood pressure, prepare for the emergency condition. And also the vasopressin, they maintain the blood pressure for the up to the certain level to respond to the stress states. Okay, this is our first part of our physiologies of memories and emotion.
Okay. So this is I'll just ask on behalf of Dr. Miat. Dr. Miat wanted to ask a few questions, so maybe we can get some responses from the audience. I'll paste the question number 1 in the chat box. So the first question for Dr. Miat, from Dr. Miat to everyone, is what kind of data are usually stored as the explicit memory? So Dr. Miat will respond to the answers. You can give your responses on the chat box. For anyone? If we remember clearly just now, procedural skill. Okay, any other responses? Things that we can remember? Data that require consciously work to remember. Okay. Kalau nak bagi contoh macam dalam perbuatan kata kerja pun boleh. Contohnya membaca, reading, or lifting your hands pun boleh. It's not necessarily kena bagi the definition. Home address, remembering home address and map. Okay. So what do you think, Dr. Miat?
Yes.
Responses.
Yes, it is regarding for our facts, our clear data. So home address, dates all are correct. And we have the awareness and we have the exact data. Okay. Yes.
Okay, so the responses are mostly correct. So our audience are still quite awake and conscious.
Thank you for your response.
Yes, you fail mathematics. All right, so now the next question from Dr. Miat to all, which is, which memory is retained in the Alzheimer's disease? Okay, you may type your answer, or if you wish to speak using the microphone also can. Okay, bahasa Melayu pun boleh. Alzheimer, old memories, old memories. Okay, that one answer. Working memories. Okay, one answer. I want to answer too. Okay, we got Daniel saying implicit memory.
Yes, implicit memory correct. Old memory correct. Working memory is halfly correct because yes, they know what they are doing now, but recently after this job, they recently lost. So means that that working memory they have partially retained. Actually, they retain its old memory, implicit memory, and also the remote memories.
Okay, so that's it, Dr. Miat, for your answer for your question.
Yes, yeah, this one also correct. Faces of old school friend, the long term memory. Yes, true, correct. Thank you for all your responses.
Okay, all right. So thank you for all responses from our audience. Proven that you're still awake and cergas. So we still doing our working memory at the moment. So now that we know both structure, hippocampus and limbic system and how it works, how it decode and code the information, it still amazed me that all these electrical impulses are able to give you the perception of the world, are able to give you the function of memorizing what you perceive, what you see, and to have some emotions in it. So looking at these two separately, we have done that. Now, what about the integration of these two components, like the integration of both structural part for memory and structural part for the emotion. So how do we actually integrate this? And just to conclude each of your talk today, so I'll give the floor to Dr. Nohida first to talk a little bit on the integration of both memory and emotions. Okay, Dr. Nohida.
Assalamualaikum, can you hear me? Yes, but I'm so sorry, Dr. Marlina, can you make me co-host again because I cannot share my screen.
Already.
Right. Okay, thank you. So my conclusion about memory and emotion would be just a very simple one. Okay. Can you see my slide? Okay. Memory and emotion is really, really important. Okay. So actually, there are many factors that related to the memory and emotion, how they link with each other. Yeah. Okay. The hippocampus doesn't just store information about facts or events. It also tags along the memories with the associated emotion. So I'm going to give you a very simple example. When you're traveling to Japan with your family, so this traveling happened like 5 years ago. So, but you still have a vivid memory of you hopping in and out of the Shinkansen or this bullet train. Okay, along with that memory is actually the emotion of happiness or joy. So this is what we call the memories that tagging along with that memory is the emotion.
Sorry, Dr. Nohida. There's some comments that your voice a little bit muffled.
I'm so sorry. I changed my device, but.
Oh, okay.
All right. Okay. Can you hear me? Yes, sir. Dr. Malina?
I still hear a little bit muffled, but I can hear you lah. The one that give comment on the chat box, can you hear Dr. Nohida's voice a little bit clearer?
Oh, wait a moment. Maybe I have to change my microphone.
Still not clear from the audience, Dr. Nohida. That's okay. We'll try to fix this.
What about now? Can you hear me? Hello? Is it better or
No change.
no change?
I think can proceed first. Let's say if we have question and things that we cannot hear, we can ask in the chat box. Is that okay?
Okay.
Okay.
What about this? Hello.
Boleh.
Okay, this will be my second last slide. Okay, because of that, the studies have shown that when an event carries strong emotional significance, the hippocampus is more likely to consolidate it into long-term memory. So the emotion is related to that kind of memory. So the better you remember that event or the memory, or the longer you have that memory in your brain. So I would like to end my slide today by asking you, do you still vividly remember your wedding day? Because your wedding day must be related with your the most happiest day in your life, or the first time you hold your first baby, or the moment someone breaks your heart. So this will be sad, happy and happy. So you can answer it in your brain or yourself. So this is explaining why this memory is still clear in your brain. I think give this stage back to Dr. Marina. Thank you, everyone. I'm so sorry for the technical.
Okay, that's all right. Things happen. Thank you, Dr. Nahida, for sharing. So it made me wonder as well, do I still remember my wedding day? Let me think about it. But I do remember, I do question myself, why do I still remember some parts of my kindergarten, but why I can't remember some parts of my Darjah 5, year 5, or why can't I remember some parts of my sekolah menengah? But I still vividly remember my Darjah 1 being asked by the teacher to dance in front of the class. Then when you talk about the integration, so now I understand that the reason why I remember that, because I feel embarrassed. So there's some part of emotion in it. So it is still there. So can I give this floor to Dr. Saiful for your integration of memory and emotions. There you go, Dr. Saiful.
Okay, thank you, Dr. Ma. Okay, this slide, I just want to show you the summary part of my presentation for today's sessions. So as you all know that the limbic system is a very important structure in human brain. Definitely you have to take care of this structure. Otherwise, you will be having a problem. That's the problem if you have a problem with the limbic system. Okay, I'm using the concept my mapping to summarize everything. This is just for the take-home message. Okay, so just now I mentioned that the limbic system, it consists of 5 important components. We have the cingulate gyrus, hippocampus, amygdala, hypothalamus, and basal ganglia. So the limbic system actually is a very unique structure, very complex structure that consists of this 5 structure. Okay, it's not just one solid structure, but it consists of 5 important structure. And we just now already mentioned about the function of the limbic system. It involves in the emotional processing, social processing, learning, motivation, and memory. So our main topic today is regarding the memory. So one of the important components that we have in the limbic system is the hippocampus. Okay, just to tell you regarding the brain itself. Okay, the brain actually, once it is damaged, we know that it will not recover or will not regenerate. But somehow there is a special about the limbic system, the hippocampus. The limbic system actually, it can regenerate, it can multiply. So that is special about this hippocampus. Okay. So, and the final part of my presentation today will be regarding the damage. If you have a damage in a specific area of the brain, it will give rise to a certain condition. Just now, for example, if it is damage in the cingulate gyrus, it can cause inappropriate emotions. And then for the damages that happen in the amygdala, the person may presented with the fearless, and then hypothalamus, the patient presented with the depression and anxiety. It depends whether it's hyperactivity or hypoactivity of the hypothalamus. autonomous. So these are the thing about the limbic system itself. So we have to take care of this important structure, which is the CPU unit of our the important part of the component of our body part. So we have to take care of the limbic structure, limbic system. Thank you for my part. So I'll return back to the Dr. Mariana.
Okay. Thank you, Dr. Saiful, for the nice flow chart. It would be nice if our medical students can look at that. So next, because it's almost 11, so I'll pass straight to Dr. Miat to conclude her parts of the integration of memory and emotions.
Okay, can you hear me? Okay, thank you, Dr. Malina. Okay, I'd like to share some of my parts. Actually, I don't have so much PowerPoint regarding for the integration. See here, you know, our emotional regulation is very important for our control of our mind. Because our ability to effectively event or control our emotional is through a wide range of approaches, because you know sometimes we have the very extremes of emotion, so at the time we need to control our mindset. So we have a lot of the control, the processing. Here are some of the examples to control how we become calm. For example, deep breathing. When an individual is stressed, breathing may become shallower and hyperventilation may occur. So at the time, if you breathe in and out slowly and deeply, there's relaxation effects on our autonomic nervous system body. So means that all the systems a little bit calm down and hormonal production a little bit begin within the normal range. So we become a little bit calm. And the next is the reappraisal. It involves the changes the way you think about the situations or yourself to change how you feel about it. Okay, and then the third one is mindfulness. It is a very common in all over the world now. Actually, it is the awareness of the one's internal state and surrounding. It helps the people avoid the destructive or automatic habits and response by learning to observe their thoughts, emotions, and their present moment experiences without judging or reacting immediately to them. So these are some of the examples to control your emotional feeling. So how the memories and emotions are integrated within our brain. Actually, emotions are deeply connected to the memory formations and retrieval. Normally, events with strong emotional element, as mentioned by Dr. Malina and Dr. Nohida, are remembered better than event without an emotional element. So strong emotion enhance memory, encoding, and also the consolidation. So it maintains as a long-term memory within our brain. And Dr. Saihu already mentioned that the amygdala activate the hippocampus and making memories more vivid. So emotion help the reinforce important experiences within our body. It makes more easier to remember. So understanding memories and emotion can improve emotional regulations and mental well-being. Emotional memories create stronger bonds and build lasting concentration with others. So for my points and as a conclusion part, I would like to conclude as a memory anchor our past experience and emotion color our experiences. So together they shape not only who we are, but also how we navigate the world ahead. Okay, that's all from me. Thank you, everyone. I will pass the mic to Dr. Malina.
Okay, thank you all three speakers, Dr. Nohida, Dr. Saiful, and Dr. Miat for the great sharing on memory and emotions. So before we end the session today, we have received a few questions from the floor and from somebody who messaged me personally. So I'll hand this question first to Dr. Miat. So we have Dr. Shazrina here in the Zoom. I have been wanted to ask to Dr. Miat about how the unintentionally you can remember the lyrics in the song. Is it explicit memory? So in terms of memorizing song lyrics as explicit memory, but you do this unintentionally. Is that correct, Dr. Shaz? So she wanted to know how do you store that unintentionally, without any intention to collect that information, but accidentally you memorize them. So can you explain a little bit on that?
Yeah, regarding this, some of the events that are very vivid to our conscious level that can remain as within our brain because they can mainly affect on the amygdalas, and it's told as a very, if the event is very active, they have more gene expression and they cause the more protein synthesis, and that causes our body myelination process. So it remains very clearly stored within our brain like that.
Okay, did that answer your question, Dr. Shaz?
Yeah, actually, the thing that last time when I'm studying, right, every time my parents they ask, why you always study while listening to the radio? So I told them if I didn't listen to the radio, I will sleep. So, but I can get both lah. Whatever I'm studying, the school and also the lyrics. So that's why until now I wonder why I can do both things together, but the lyric one unintentional because I only listen, right? But the answer my query so far, I think thank you to Dr. Miat. Yeah. Thank you so much.
Because it has so many repetition, right?
Yeah, true. Thank you.
Okay, thank you.
Okay, thank you for the question. So there's another question. I'm not sure who this one belongs to. I think Dr. Saiful or Dr. Nohida can choose to answer this one. There's another person asking here, Miss Elizabeth. So what kind of food and supplement do you recommend in order to improve memory, especially those in 5 and 6 series? Because I remember Dr. Saiful mentioned the limbic system is able to be regenerated. So I wonder if that also have anything to do with the food and supplement for 5 and 6 series. I'm still not 5 or 6 series, but I would like to do the same thing during my own series now. So what do you suggest, Dr. Saiful or Dr. Nohida, on the food and supplement that you recommend to improve your memory, especially for the elder part of your life?
Okay, from my part, so I would like to suggest there are some of the supplement that you can take. For example, omega-3 fish oil. This is the example of the supplement that you can take. Maybe also vitamin B lah, B6, B12, and also B1. Okay, so these are the important supplement that you can help your brain to function normally. Okay, in case if you have a problem, for example, if you have the degenerative disease, so this is the kind of the supplement that you can take in order to regenerate your brain tissue, especially in the hippocampus area, because the other part of the brain cannot be regenerated, but somehow only the hippocampus can regenerate. Okay, this is actually to empower your memory. So maybe Dr. Nohida, maybe she has another view regarding this supplement.
Okay. What I have read about the supplement that can actually help with memory, one of them is actually ginkgo biloba. Have you heard of that thing, ginkgo biloba? Yeah.
How do you spell that, Dr. Nohida? Maybe we
G-
can find in pharmacy.
But this is the leaf of the ginkgo biloba. Ginkgo biloba leaf. This is rich in vitamin B, which is important for your neuron. Okay, and other than supplement, exercise can also increase your the level of BDNF in your system. So this will further help you with good memory retention. Other than supplement, in form of foods, exercise is very good too for your brain power. Thank you.
And the other thing that I also like to highlight here regarding how we can empower our memory system in our brain is actually maybe you can have a rehearsal mechanism where maybe you need to read and also make sure that your brain is function every day. Okay, that actually is shared by Dr. Mahade, where he shared regarding how actually at his age, 1990 years old, but somehow he still can remember what happened in the past 50 years old, 15 years ago, because actually he tried to retrain his brain every time by maybe by reading the books and by looking at the internet and so on. So there is another way of empowering our brain function. So you have to make sure that your brain is actually every time functioning properly without that is the thing that maybe we can do lah. For example, you can read books, you can read the internet and so on. Okay, to ensure that the brain is function. Because once you read something, actually it promoting the synaptic transformation or synaptic formation that happen in the body, the connection between the nerve. Okay, that is actually the way that we can promoting the memory enforcement in our brain.
Okay, that's quite interesting. So the take home here, how to make sure that our memory is improved when we reach 50s and 60s is by getting the supplement omega-3 and this ginkgo biloba leaf is some highly investigated scientifically in laboratory. And what Dr. Saiful mentioned was about training your brain. So there has been some papers or previous research or project that has identified a significant improvement in memory among elderlies who have been practicing Sudoku, all these crosswords. So this is how you can make your brain work better, right, Dr. Saiful? Not just simply by scrolling through Instagram or Thread or X, and then join in the commenting parts as the doing your job as the netizen. So which means healthy activities makes your memory stronger lah. Okay, so I would like also to ask one question probably to Dr. Nohida. I have been wondering, when you talk about the function of memory in regards to sleep, so what makes our brain able to consolidate or to store this memory when we are sleeping? Does that mean that if we study, kalau kita belajar during the day, we're not sleeping, does that make our memory less effective? Or because we can suggest this to our students or to anyone that of our immediate family on when they can actually do their revision, when they can actually do and to learn new knowledge. So can you help me answer my curiosity?
Okay, I'm gonna repeat your question. It's about how sleep help with memory consolidation, isn't it? All right. Okay. So remember when I talk about the cortex, all the information from external that is received by different parts of the cortex, all during conscious. That means when we are awake. So the information gathered into the cortex when we are awake, but when we sleep, all this information is actually cut off or minimized. So no more external stimulation. So now our brain is on time to do her work. Okay, so brain said, I have my own time to clean the data that I receive before I sleep and to make it stronger by consolidating it, reorganizing it, and without external distraction. Can you get the point? So during sleep, it's actually there are different parts of stages of sleep. One of them is called rapid eye movement sleep. Okay, in rapid eye movement sleep, the brain activity is actually equal to awake stage. So that means brain is actually working during our REM sleep. Okay, for your information, REM sleep is when it's not the earlier stage of the sleep, it's the later stage of the sleep. Okay, like for instance, when you sleep at night, so you go to the arousal stage, and go to stage 1, a slow wave, stage 2, stage 3, and stage 4, and finally REM sleep, rapid eye movements. And this REM sleep, there's no slow wave, it's no slow, but it's active wave brain length. So the activity of the brain during REM sleep is as equal as awake, but the difference is we are sleeping, so no distraction. So now the brain can do all the we call it as housekeeping. So we arrange the data and make it consolidate by creating further trisynatic loops and consolidate it and move it to the area for long-term memory consolidation. This is called long-term potentiation. Okay?
Okay, that answers it. So which means kalau waktu malam we have lesser sensorial information and input, which makes our brain able to focus on one thing. So that's how we usually divert our patient, and when we do this reflexes that we ask them to clench their teeth, there's the rediverting of attention of the brain. So I got another question from somebody to Dr. Miat. This question asks, why do we forget? So are there any reason for being forgetful? Is it the memory not being consolidated well, or is it the memory, the short-term memory is not being processed because we have brain problem? Remember when we talk to our friends, sometimes they become blur, lost in the track, loading sekejap these people, nowadays people call them loading. So they're loading, but they do not know what we're talking about and doesn't recall whatever we talked to them 5 minutes ago. So is there any reason why we forget such thing, or is it us just being ignorant?
Yes, actually, sometimes, we have the process, the consolidation. Sometimes the consolidation process is lagged. So at that time, we cannot store this one as a memory. And also sometimes there is a new information, means that at the same time, it was interfered by some new information. So at the time, this can also cause the forgot things. And then sometimes the neural pathway is decay, or maybe that neural pathway cannot function very well. So at the time, we can lost, we can forgot. And some of the emotional trauma and stress, they can affect on our memory system, and they cannot retrieve properly because of these strong emotional influences. That's why we forgot things.
Okay, so which means our brain memang exactly like the computer. Sometimes it laps just like my computer just now. So lagging, and then sometimes it needs some this update. So like Dr. Nohida said, the update is usually at night, so that it clears up all the cache and all the unnecessary files or document. Okay, so now sometimes also when we want to open up a window or words, it laps a little bit lah. So that's how I understand that. Is that correct?
Yes, definitely.
Okay. All right. So just to conclude, so what we have learned and discovered today, that memory and emotions are heavily linked to each other, and it's fascinating how a human can decode and perceive that whatever we see, whatever we feel from the sensory, some may be true, perceived by ourselves, some may not be true. So which means it depends on how your brain want to decode the information. My happiness level will not be the same with Dr. Miat's happiness level. So my sadness level won't be the same with Dr. Saiful's sadness level. So my anger will not be the same with Dr. Nohida's anger. So which makes us unique. But through this integration of both memory and emotion, we live harmonically between each other, because this part of the world or sensory experience in terms of common sense and everything, it merge and integrate between these two systems, right? So that's why we all can communicate and talk to each other, understand each other. Otherwise, tantangkan all these stimulus that comes to us are actually alien language. So Thank you to all of our three speakers and especially to our viewers or audience today. So we thank you so much for attending our session. But before we leave today, we would like to take a gallery photo. If you are able to open up your camera, then we can take a quick photo among ourselves. Is that okay? So then after this, I will show the QR code again for those who miss out the QR code. Okay, so we'll be doing snapshotting because that's the easiest one. So we'll take the first gallery. So a smile, first gallery. 1, 2, 3. Okay. And then let me take the second gallery first. Okay, gallery 2 or okay, so gallery 2, smile, even though you're not opening your camera, smile. Okay, gallery 2. Now we need the gallery 3. Wait, I'm doing this slow because my computer is lagging. My brain is lagging. So for layer 3, 1, 2, 3, 4, smile. Okay. All right. Awesome. So with that, I would like to end today's session. So hopefully we can meet up again in our next brain series. We actually, in our department, we have a lot of us who have major interest in neuroscience or neurobehavioral experiments. So feel free to reach out to us. So perhaps we can do something extraordinary next time. So remember me, remember our speakers, and please put the good emotions in your brain to remember today. So that's all for the Unraveling the Brain series today. So I will share my QR code again, and you may leave the Zoom right after you scan. Thank you, everyone. Okay.